And then finally, as we look at the nursing plan of care for chronic leukemias and looking at chronic lymphocytic leukemia CLL, the nursing diagnosis that I chose was pain related to enlarged spleen and lymph nodes, as evidenced by increased white blood cell count and patient reports of pain in the left upper quadrant and lymph nodes. The first nursing goal related to this diagnosis is that the patient will participate in pain-reducing non-pharmacologic interventions. Nursing interventions related to that will be the patient will utilize hot and cold compresses as a method of pain reduction and will use diversionary techniques such as television reading, listening to music, or engaging with community to help reduce pain sensations felt. The second nursing goal related to this diagnosis is that the patient will exhibit knowledge and skill necessary to administer pain control medications. So interventions related to that goal is that the patient will verbalize the avoidance of NSAIDs as they can cause a decrease in blood counts, which they are likely already experiencing, and the patient will express the use of opioid analgesics as a pain control method based on the pain score that they are experiencing. In looking at chronic myelogenous leukemia, or CML, the nursing diagnosis that I chose was risk for bleeding related to overproduction of immature cells in the bone marrow, as evidenced by easily bruising and low platelet counts on blood tests. The first nursing goal related to that diagnosis is that the patient will exhibit knowledge on precautionary measures to prevent bleeding by avoidance of tissue disruption and alteration of clotting mechanisms. Nursing interventions for that goal include the patient will verbalize the understanding of using a soft bristled toothbrush to prevent oral bleeding, and the patient will explain the need to remain on a bowel regimen to prevent straining. The patient will also explain the need to be cautious and avoid, if possible, the use of sharp objects such as razors, scissors, anything that could end up causing any sort of bleeding. And then the second nursing goal being that the patient will utilize measures to prevent skin breakdown and drying to prevent bleeding in that manner. Interventions related to that goal include the patient using saline nasal spray to prevent drying and bleeding from the nasal passages, and the patient will utilize emollients and lotion to prevent skin cracking and breakdown and bleeding.